Chuck. Thanks so much. Now, just about everyone has trouble sleeping now and then. I mean, I've had those problems. But what if you're having problems that are more serious than you realize? And what if it's putting a strain on your relationship, maybe through snoring? Dr. Anju Ely is a dentist, and she's here with us with solutions that you may not have even known existed. Thank you so much for being with us. Because people do joke about snoring, but it's serious. And off camera, I was telling you about how my dad used to snore really badly and how it's something that a lot of people deal with.
Right, and that's actually how I got into this field. My dad also used to snore really badly, would completely bring the house down with his snoring. And, you know, we used to joke about it. And my mom specifically would have to go to bed before my dad. Otherwise, there was no chance that she would fall asleep.
Okay.
And we would always pray and hope that he would just stop snoring for just a few minutes so that we could fall asleep. But what we didn't realize is he wasn't stopping snoring. He was actually stopping breathing. And I lost my father at a young age. So it's no doubt that sleep apnea played a role in his early death in life. And if I can raise awareness and help other families realize that snoring's no joke.
Right.
That's what we're here for today.
There are some really great solutions to this problem. And also, I want to introduce Sarah Richardson, who's also here with her assistant. But let's bring in Dr. Isaac Grinberg. Thank you for being here.
Thank you.
And you've been helped with some of these solutions, right? Let's talk about what you did for Dr. Grinberg.
So for Dr. Grinberg, I made him an oral appliance. Now, all of these appliances work very similarly. They take the lower jaw and they move the lower jaw forward. You know, the tongue is attached to the lower jaw. So the idea is if we move the lower jaw forward, we can move the tongue out of the way of the airway, which is what's happening when people are having sleep apnea. The tongue is actually falling back into the airway along with the other tissues at the back of the throat and closing the airway, and in essence, the body is being deprived of oxygen.
Okay, so explain to us about the sleeping tests that are done.
Okay.
To figure out if that's what if you actually have sleep apnea or it's just something else.
So not everybody who snores has sleep apnea, but 70% of loud snorers do have some form of sleep disorder breathing. So the first step is getting a sleep test. So there's a couple different ways you can get a sleep test. You can have an in-lab attended study, or you can do a take-home test. So we have a take-home test that we offer through our office, and Sarah's going to show you how easy it is to put on. But basically it's a monitor. It sits on the forehead. It has a nasal cannula to measure flow, and all the sensors are right here in the forehead. So this can record overnight. And once we have the recording, we can send this off to a sleep physician, a board-certified sleep physician, for interpretation and to get a diagnosis. Wow, and then once we have a diagnosis, we take it from there.
Okay. So, Dr. Grinberg, how easily does your appliance work? Is it in the way when you're trying to fall asleep? How is the ease of use?
So it's fairly easy, actually. Okay. And before I started using it, I had some trepidations about comfort issues and would I even be able to fall asleep or stay asleep with it. And it's very interesting because it's a little awkward, maybe the first night or two, and then it feels totally natural.
Okay, now how's the quality of sleep been for you?
And that's the major thing. You wake up in the morning refreshed, you feel like you've actually slept well. And that makes a huge difference.
And you're not.
And his wife's happy.
Right, because that's a big component of it too.
You wake up and your wife is actually next to you. So.
Right, and hasn't left the room.
Right.
That is awesome.
And he has his appliance with him.
I do.
Okay, let's take a look at that.
Right here. I chose blue.
Okay.
Go blue.
I see you like
to match,
it.
right?
And she said go blue. Okay, I get it here.
You want me to put it on?
Sure. That's easy.
That's
it.
It's very simple. It's kind of like putting a retainer in at night.
So some patients are candidates for this treatment. Now, patients that have severe sleep apnea, they would want to wear probably a CPAP mask. And so this is another therapy that patients can be offered or recommended by the sleep physician. But if they can't tolerate it, if they can't wear it, which is what happens unfortunately to a lot of CPAP wearers, then this can also be an option for those patients.
That's a great option, but all of this is analyzed and figured out for you by your sleep doctor, right?
Correct.
All right.
Correct. So we work very closely with the sleep physicians, cardiologists such as Dr. Grinberg, pulmonologists, And we all work as a team.
Awesome. So where can people get more information?
Well, they can call our office. We are located in Novi, very close to Providence Park Hospital. Our phone number is 248-347-3030. And our website that you can get more information is www.novidentalsleepmedicine.com.
Awesome. Thank everyone so much for being here. This
Thank
is
you,
great
Jackie.
information. Jason, over to you.